Now I invite Sri Rajiv Vasudevan. Rajiv Vasudevan is a founder of the first and only National Quality Award winner Ayurveda sector hospital known as AyurVAID hospitals. There are 3 hospitals that are NABH accredited and 1 that is JCI accredited. Apollo Ayurveda is a pioneer and leader in quality systems driven precision Ayurveda medical care rendered through a model of integrative care in partnership with leading quaternary care hospitals across the country. He is also a member of various national technical committees and expert groups of Ministry of Ayush, Niti Aayog, CII, as well as select state governments and industry in India. He is a very good friend of mine. We are working together since so many years.
Thank you very much, respected Chair and my esteemed co-panelists. And I would like to begin by thanking the Department of Health and Family Welfare Gujarat for inviting me to be part of this deliberations. I hope I can contribute to the larger policy thought process in the state. So the topic assigned to me is the role of precision Ayurveda in integrative medicine, right? And in the allotted 15 minutes, 12 to 15 minutes, I'll speed through and then await questions after that. So if you look at the agenda, I'm going to talk about the context in which we need to look at policy making. What is the role of, what is precision Ayurveda, integrative medicine, and how does it lead to definition of a vision for Gujarat, right? Is it possible to add to that vision, the health vision? So the first slide coincides or is derived from something which Ms. Phillis also did say, but the takeaway essentially is that you can see the disease burden in India has come down to that extent. But globally, one feature is while the number of dailies has plateaued, right? While the longevity has increased, but the improvements in daily is plateauing or reversing, notwithstanding the fact that people are living longer, which means you go to Japan, people would live to 90 or 85, but today they're not as healthy as they were earlier. Right, so just living long is not sufficient. You have to live long, and that's the entire concept of Ayurveda, right? The knowledge of fulfilling your complete or self-actualizing your potential, not only in terms of longevity, but in terms of your self-actualization potential. So when you look at true holistic health, I just want to say, and we should understand, Ayurveda is the ultimate systems thinking applied to health, and this picture represents that. It talks about every human being buffeted by stressors from the environment, whether it be physical, mental, spiritual, right? You may say under mental, you might bring in emotional as well. So if I look at that, we have to understand it's like being on a tightrope walking, particularly in today's environment. And why I want to stress, and Ms. Neelam, I want to say it's not just Chinese medicine, but man and environment was posited originally by Ayurveda, and it is the mother system of medicine. Forget about calling it an alternate system. It is absolutely a joke because it stems from ignorance to call it an alternate system, because it is the mother system of medicine of the world. And even to the extent there are historians who say the Greeks, many of the things which went from here, and I don't want to get into a longer deliberation on that, but we should understand that the concepts are timeless. Principles are universal in application. Now, when you look at this particular thing, the concept of homeostasis, which is as recent in modern medicine as 1876 or so, is being posited in Ayurveda 2.5 millennia back. So we'll understand how does this play out in practice. So the oft-quoted definition of good health by the WHO, which dates back to the 1976 period, goes back to 600 BC, where I talk not about disease as the absence of disease, but the presence of positive parameters. Good sleep, good digestion, good bowel movement, good micturition, a calm state of mind. And as I tell here, clarity of senses, being alert. When you wake up in the morning, am I optimistic about life? So this is captured in a very precise shloka, right? You don't need to go back and say. So the whole thing about a healthy person is defined in positive terms. And I have played with that shloka to add good sleep and no pain to it. But otherwise, each of those things are there in the definition of Ayurveda's good health. So how does it achieve it? And we need to understand that holistic health we need to look at it in 2 or 3 ways. It's not only physical, mental, spiritual, but also the approaches to health. So I was so happy to see Ms. Kim's slide. I'm taking advantage of your slide of social and behavioral characteristics. Not only bad habits, but the presence of good habits. What is the dinacharya? What is the ritucharya? What to do when? Today we are forgetting all of that, and we are trying to follow what is good for Italians is good for Italians. If I eat olive oil, it is not good for me. A Gujarati eating what is good for a Bengali or what is good for a Punjabi. It is not one size fits all. We're all a nation of multiple, people of different body types, metabolic types, food habits, seasons, and you can't have a one size fits all. So what this tells you, the most personalized and complete approach of ahara, vihara, vichara, aushadha, kriya. One or more. If you catch a disease at an early stage, prevention, only appropriate diet, lifestyle. Today with the burden of mental health being so much, stress, focus on these 3. That's the social behavioral change that we should focus. Medicine where required, gentle medicine, herbal medicine, and where required, deep system cleansing therapies, which restores that homeostasis. And the fact that Ayurveda today plays a clearly complementary role. They don't compete, there's no need to compete. In fact, it is a Brahmastra, I say, for countries like India to reposition healthcare itself, healthcare systems. Let's not reduce it to a wellness massage kind of thing. It is a complete health system which is able to complement in every area other than emergency medicine. Pre-acute and subacute, post-acute, right? And as we'll understand, in all the mainstream conditions. Let me assure you, if any condition is mentioned here today, all the major Ayurveda institutions in the country are treating patients very effectively in these areas, right? We'll go to evidence as we go along. It's also important when we look at health that disease progression, right? When you take a country like India, 7 to 10 years prior to being diagnosed with diabetes, my insulin resistance has already peaked. But if I just go and measure my blood sugar, I'll be told I'm okay. But I'm already, the problem has set in. What Ayurveda does, as I can share this here, is that in that golden window of opportunity, figures out emerging risk factors, what we call the Manda Agni symptoms, the Agni going down, the Ama going up. All of this is positive, clearly depicted lakshanas, or the signs and symptoms depicted in the body. So we are able to pick that up and then catch it early. So this is one of the very powerful tools actually for India to effect what we call primary prevention, secondary prevention. So as we go in here, we have another facet to remember. This single cause, single effect, symptom-based approach that we take, we forget most people today suffer from multiple comorbidities. So my colleague, the gentleman from the US will agree, 76% of the Medicare bill goes to people with 5 or more chronic diseases, right? And we're talking about treating one disease or the other. We have to say reality is this. Even in India, we're going to get to this scenario. So we need a system which takes care of the person as a whole. That is holistic health. The fact that Ayurveda, and I would respectfully differ from respected Professor Jayadevan, there are many institutions today which practice extremely documented, thorough, protocol-based care. What I'm trying to show here in diabetes care, 3 patients, all in the 10% plus HbA1c level. The disease tree, personalized disease health tree, is different for all 3 of them. The factors which led them to have hyperglycemia, right, or increased blood sugar in the blood is not the same. You have to treat them. Ayurveda posits a way to reverse the disease pathology tree right to the etiology. So reverse the etiopathogenesis. Ayurveda gives the most mature system of approach to treatment of serious diseases in the world. And one day, it'll be shown. I have 5 minutes, so I'm going to rush through. So the thing is that diabetes clinical outcomes at a mass level, you can see the level of outcomes that we are able to achieve. 100 mg per 92 mg per DL reduction for people with FBS about 200 mg. 2.2% reduction in HbA1c across a sample size of 49 people. So when you look at integrative medical care, we have to understand there are a lot of confusions about what this stands for. Integrative medical care is specialists from 2 systems of medicine working together in the best interest of the patient. right? Depending on the stage, each specialist, it's not mixopathy. It's not one doctor doing both. It is about people collaborating in the best interest. So this can go as an adjuvant therapy. It can go in palliation and rehabilitation. It can go into what is called therapeutic wellness and in promotive health. So as I'll show you, the best of both worlds in the best interests of the patient. So take this as an example. Stroke patient, first phase neurosurgery, next phase neurosurgery and physiatry. Third stage, physiatry and Ayurveda comes in. Ayurveda for functional health improvement. Fourth stage, Ayurveda becomes primary, neurosurgery and physiatry become. These are real cases that we treat today in our partner hospitals. So if you look at this, clinical outcomes very systematically derived, objective parameters where possible, international outcome scales, all of this can be applied. Nothing precludes the use of very standard objective measures in Ayurveda. And the fact, so these are all scales. In the interest of time, I'll quit. Integrated medicine, examples here being done today in oncology, in neurology, in nephrology. Right? Today, just today, we got a case of 8% or 9% serum creatinine down to 4% in about 3 weeks' time, right? In Aster CMI. So through Ayurveda medication, where the nephrologist and the Ayurveda doctor work together. So this is a very important slide. I'm coming towards the conclusion of my presentation. We have so focused on primary, secondary, tertiary, quaternary healthcare, which are different ways to go and do hard interventions with a person. Let's look at truly in the preventive healthcare lens, where holistic healthcare at a community level can be imagined. We have to begin with primal prevention, the health of an expectant mother, so that the child yet to be born. Look at the state of affairs. Today, most of the states in India are plateauing in terms of the Niti Aayog's health performance index, right? You take the states which have leapfrogged. Today, Gujarat is at number 6. It was in the 4, 5, 6 rank earlier. But you see, the improvement in performance can happen only if we are able to tackle primal prevention, primary prevention, secondary prevention. So if I have an expectant mother, if I don't tackle the gestational diabetes, other issues, metabolic issues, I'm creating future generations of under-potential Indians, right? So that is where Ayurveda can play a very important role. Number 2, primal prevention. Apart from looking at clean water health and other things, clean water, mosquitoes, etc., Ayurveda can come in with a very positive regimen for underweight children. You can look at the diet lifestyle, which is conducive for these people. But secondary prevention and tertiary prevention is where Ayurveda will be truly marvelous in complementing modern medicine. 2/3 of healthcare demand today, and this is Government of India data, right? 2/3 of Indians die because of a chronic disease, non-communicable disease, not due to an acute emergency care. The single-minded obsession on just tertiary, quaternary care is making us miss the true picture. I want to suggest the state of Gujarat has done a fantastic job. I was so impressed today, right? Not just the pharma sector, 32% of national manufacturing, you contribute 28% of exports. Amazing performance. I mean, I was just mind-blowing. It was mind-blowing. But please remember that where will the next change? And dialysis, the kind of number of dialysis points that you've created, is amazing. I think it's very important to see where do we achieve that next jump, quantum leap in healthcare indices. Final 2 points here, that medical value travel, right? The people who come to India are not many from the developed countries, OECD countries. Those who come to India, they come for Ayurveda and yoga, right? The data might tell you that, you can see here, that Ayurveda is at number 5 ranking for non-resident Indians in terms of the reason that they come. This is based on visa data with the Government of India. This is published data, right? So they're not coming for modern medicine. So NRIs, Gujarat has got such a huge diaspora. How do you reach out to them and tell that this is an Ayurveda destination, right? Also, Kerala, for example, right? 30% they state. I think it's even more. People from OECD countries come for Ayurveda and yoga. So the Ayurveda marketplace is very rich. You got products, services as an industry-led, growth-led state. There is a variety of services across curative, preventive, promotive, integrative, resorts, leisure, wellness, etc. And the fact that the Government of India, right, very ably led by the Rajesh Kotecha ji in the last 5 years and more, has ensured an ecosystem which has really come in. NABH is there, ISO standards for various areas has come there, appropriate integration is more and more welcomed by industry today, straddles disease management and well-being, insurance is approving, private medical insurance, IRDA, etc. Just one more minute. And talent pool, 40,000 doctors coming out every year. So this is a situation, research has been really supported, enabling government regulations. So we have a situation, the market is ready, the people are asking, right? Policymakers need to step forward and say, let's do the next step to make the supply of Ayush to the people more and more accessible. Entrepreneurship, Gujarat is a state of entrepreneurs. You create that small enabling environment in the state, whether it is giving capital to Ayush doctors to set up clinics and hospitals, accessing through state government cover Ayurveda. Uttarakhand today covers Ayurveda under their state government scheme. So these are the things that you'll do. Today railways, defense are covering it. So through this approaches, many more entrepreneurs, doctor entrepreneurs will come. Huge employment opportunity, both within the state and for the world. Ayurveda is a high-touch business, high-touch in two ways, right? High-touch in physical, high-touch in emotional. And that is what today, I would say, most of modern types of services is lacking. It is very, very transactional, right? Operation kya niklo. Here we are able to bring the balance part. So I think we are able to complement this. And to sum up, globally, NCDs and chronic disease predominate. Ayurveda has got a huge role to play. Ayushman Bharat sooner than later will cover Ayurveda. That's our fervent hope. It is going to open up employment opportunities. There is going to be not just for disease, but for well-being, there will be different opportunities. Corporates are going in, and Ayurveda and yoga can address the health need gap very effectively. Huge employment potential right across this thing. My last slide, there is a vision for Gujarat and through Ayurveda. It is very clear with the demand, with the institutes of national importance in Jamnagar, Gujarat Ayurveda University, the only one in the country. You're looking at the scientific foundation through the Global Center for Traditional Medicine. The entire traditional medicine sector of the world today has headquartered. The intelligence is sitting right here in Gujarat. How does Gujarat leverage that, right? We can't just sit with the jewel in the backyard and ignore it. And the fact that extremely good quality colleges, I don't know if you're aware, but apart from Jamnagar, the Ahmedabad College, the Baroda College, the Surat, each of them produce Nadiad College, very good Ayurveda doctors. They should all be deployed to serve the people of this state. Ayurveda and yoga complete the healthcare value proposition, high value proposition, curative, preventive, promotive, as well as well-being. Leverage Ayurveda to serve citizens of Gujarat, India, and the world, and position Gujarat as a healthcare destination. The Heal in India program announced by the Honorable Prime Minister to make India a healthcare destination, Gujarat is very well poised to be that destination. It needs to take that commitment to Ayush and leverage all its strengths. Through that, health for everyone, everywhere, and at all times will be achieved. Thank you very much. These are the hospitals. I just want to tell you that we run. These are all NABH accredited and various recognitions right from Harvard to JCI, NABH, etc. Thank you very much.
See, Rajiv Vasudevan has, all fresh, and he has challenged actually government of Gujarat. And he has, government of Gujarat is sitting here. So I would like to, pass this, his challenge to government of Gujarat for this opportunity of catching it up. So, and then he had talked about, precision Ayurveda with lot of evidences. He had actually explained some of the case records, masking the names, but these are real true because I've seen those and I've studied those, evidences. So he's not just talking, but he's actually doing it in hospitals. So that provides an perspective that can be delivered in the area of as an adjuvant, in integrative care, in ophthalmology, in the oncology, in neurology, in nephrology, and lot of hospitals in India are doing it actually. And that is what our Dr. Savani also has mentioned. And then, he talked about a definition of integrative medical care, and not only adjuvant but rehabilitation, therapeutic wellness, promotive health, and so on. And when he talked about personalized medicine, he talked about locally culturally sensitive diet and lifestyle, which is very important. And that is well, going with the statement of Miss Lee about, this precision, no, Miss Neelam's statement about precision, personalized, and predictive medicine and promotive medicine. So.